You have chosen peritoneal dialysis to treat your kidney failure. This type of dialysis helps to clean your blood and remove excess water from your body by using the peritoneal membrane in your abdomen. A catheter has been inserted into the peritoneal cavity, and through this tube, your dialysis fluid will dwell in your peritoneal cavity, filter your blood, and remove waste products from your body to help you live a healthier life. This video will help support the training you've received by taking you step by step through both types of peritoneal dialysis, CAPD, or continuous ambulatory peritoneal dialysis using the Baxter Twin Bag, and APD, automated peritoneal dialysis with the Home Choice Pro Cycler. You will also be reminded how best to keep yourself free of infection, take care of your catheter exit site, add medication to your dialysis solution, and keep your fluids balanced and control your blood pressure. Like most patients, you will find that, although it may seem overwhelming at first, peritoneal dialysis is easy to learn, flexible, and more portable than hemodialysis. With fewer trips to the clinic and a less restrictive diet, peritoneal dialysis will help make life more enjoyable. Continuous ambulatory peritoneal dialysis is a manual form of dialysis, where fluid flows in and out of the body using gravity. Over time, waste and extra fluids build up in the blood. These wastes and extra fluids slowly float across into the peritoneal membrane by a process called diffusion. An exchange removes dialysis fluid from the peritoneal cavity and replaces it with new fluid. 4 exchanges are done every day. Each exchange takes 30 minutes to complete. After the fill, you are free to go about your day as usual until it is time for the next exchange. Setup. Clean your work area and set up your supplies. You will need a twin bag, 2 red clamps, a mini cap, gauze, a clean towel, paper towel, and some hand cleansing gel. If you are coughing, sneezing, or however feel you are getting a cold, you should wear a mask. Wash your hands so that they are clean. Do not use gloves because they are not sterile and give a false sense of security. Before heating up the bag, check the expiry date and the percentage. You may now heat up the bag with a heating pad or any other kind of dry heat until it is at body temperature. Open the bag and pat the full bag dry with paper towel. When checking your solution bag, you should be able to answer yes to the following. The solution is clear. The solution type, dianeal, extraneal, or neutroneal, and dextrose percent is correct. The expiration date has not passed. The volume is correct. The green seal is intact. The medication port and pull ring are in place. After gently squeezing the solution bag, there are no leaks. Hang the full bag on the top of the IV pole. Put the empty bag on the floor or on the bottom hook of the IV pole. Sit down on a chair next to your supplies and IV pole. Get your transfer set out and place it on the clean towel on your lap. Ensure that the clamp is closed and leave it on your lap. Clean your hands again using hand gel. It is important to use enough gel to cover both sides of your hand and rub until they are dry. Remove the pull ring from the twin bag connector with one hand. Drop the ring onto your lap. Keeping hold of the twin bag connector, pick up the transfer set and remove the mini cap. Drop the mini cap on your lap and connect the two at once. Wipe away any excess iodine with gauze. Avoid touching the twin bag connector and the transfer set to prevent infection. You are now ready to begin draining. Drain. Open the transfer set twist clamp to drain. The fluid should start draining out. This can take up to 20 minutes. If it is your first exchange of the day, while you are draining, you may take your sitting blood pressure. Log the results on your CAPD log sheet. Next, take your standing blood pressure and log this on your log sheet. Blood pressure helps to determine the correct fluid balance. A higher than normal blood pressure may be a sign of fluid retention. When the drain is complete, place the red clamp on the drain line. Close the transfer set twist clamp and ensure that it clicks in place. Flush. To ensure that the fill line is free of air bubbles, it is necessary to flush the line. To do this, break the green plastic seal on the end of the fill line that is closest to the twin bag connector. Grasp the seal with your thumbs and forefingers and break it by rocking it back and forth several times. Open the red clamp and count to 5 while the air bubbles flush into the drain bag. Then close the clamp again. Fill. Open the transfer set twist clamp to fill. This takes approximately 8 to 10 minutes. When full, close the transfer set twist clamp. Ensure that it has clicked into place. Place the second red clamp on the fill line somewhere below the level of the hanging fluid bag. Check the expiry date of the new mini caps. Open the mini cap package by placing it foil side down on your supply surface. Peel back the packaging and expose the mini cap. Clean your hands again using the hand gel. Place the fingers of one hand on the light blue area of the transfer set. With your other hand, undo the twin bag connector. Keep the transfer set in your hand, letting the twin bag connector drop to your lap. Retrieve the mini cap from the packaging and place it on the transfer set immediately. Secure your transfer set. Check the drain fluid for clarity by placing the gauze packaging under the bag and ensure that the package labeling can be read. If the bag is cloudy, follow instructions and contact the dialysis clinic or hospital as you were taught. If the bag is clear, take it to the bathroom or shower and place the bag on a hook or the back of the toilet. Put the twin bag connector over the toilet bowl, remove the red clamps, and drain into the toilet. Once drained, put the twin bag in your household garbage. If this is your first exchange of the day, it is important to weigh yourself now and log this on your log sheet. A weight gain of 2 kilograms or more may indicate fluid retention or fluid overload, while a weight loss of 2 kilograms or more may point to dehydration or excess fluid loss. APD, or automated peritoneal dialysis. Automated peritoneal dialysis offers the freedom and flexibility that many adult and pediatric patients prefer. A machine does the exchange at night so that you are free to enjoy your day without having to do dialysis. Setup. The Home Choice Pro Cycler can be set up any time of the day so that it will be ready for hookup in the evening. Upon initial setup, ensure that the cycler is placed on an appropriate table, the height of which is within 6 inches of the bed level. The table should allow enough room for the number of solution bags needed throughout the night, as well as any supplies needed during setup. Note that there is a 24-hour helpline contact number located directly on the machine top. There are 2 approaches to programming your cycler. Either you will be taught to do this, or your dialysis team will do it for you. Gather your supplies. You will need 1 mini cap, 1 Opti-cap, some hand cleansing gel, a cassette package, 1 or 2 12-foot extension drain lines, solution bags for the entire night, a clean towel, paper towel, gauze, a face mask if you are coughing or sneezing, and a clamp. Wash your hands so that they are clean. Check the expiry date, percentage, and clarity of the bags. Open the bags and wipe them with a paper towel if there's excess moisture. Squeeze them to ensure no leaks are present. Place the first bag on the heater on the machine and turn it on. Place the other supply bags beside the machine. Press Go. The cycler will say, "Load the set." Open the cassette package as directed on the package. This is the drain line. Heater line with the red clamp. Supply lines with the white clamps. Last fill line with the blue clamp, and patient line. The short line is also called the sample line and is rarely used. Your dialysis team will let you know if you ever need to use the sample line. Close the white clamp on the short side line of the sample line. You will need to close clamps on any unused line of the supply line or last fill line. If you use 4 dialysis bags on the cycler, all your lines will remain open. If you only use 3 bags, one line will need to be clamped, either one of the supply lines or the last fill line. Open the door on the front of the cycler, load the cassette inside, and close the door. Hang the blue organizer on the front of the machine on top of the door and ensure that it has clicked on the hook on the door. Press Go. The cycler will say Self-Testing. While the machine self-tests, continue to do your setup. Get the drain line ready. Open the 12-foot extension drain line package. Take the tape off the extension drain line and attach the drain line to the extension drain line. Take the blue cap off the drain line and dispose of the cap. Set the drain line up in the toilet, shower, or sink to drain. To ensure that the drain line cannot move during the night, for safety, it is best to secure it with tape to the floor. When using the toilet to do the drain, make sure that the end is not in the toilet water. Wash your hands in the sink, although we want to stress the importance of cleaning your hands just prior to connecting. When the self-test is done, the machine will prompt you to connect bags. Place a mask over your face if you're coughing or sneezing, and clean your hands again using hand gel. Connecting bags. Starting from the right, take the line with the red clamp and cap from the cycler tubing. This goes to the heated bag. Remove cap from the heater line and then pull ring from the bag. Be careful not to touch the open ends. Twist the two together. Once they are together, break the green seal at the neck of the tube with thumbs and forefingers. Move in a back and forth motion to break the seal. Check to make sure it is completely broken. Take the next tube on the right and repeat the connection. Repeat with the remaining bags. If your dialysis team has instructed you to use extra Neal or Neutral on the cycler as a different last fill, it must be connected to the tube on the far left with the blue clamp. Ensure that all clamps connected to bags and the patient line clamp are open and that there are no kinks in the tubes. Remember to break the green seal on all the bags. All unused supply lines must be clamped off. Press Go. The cycler will say priming. Priming clears all the lines of air and takes approximately 10 minutes. When priming is done, the cycler will say connect yourself and check patient line. Check that the patient line has been properly primed. The cycler is now ready for use and will wait until you are connected. Connecting yourself. When you are ready to go to bed, ensure that all your supplies are nearby and check that the patient line has been properly primed. Put on your mask if you are coughing or sneezing, and clean your hands. Sit down on your bed and place your towel on your lap. Place the transfer set on your lap. And clean your hands. It is important to use enough gel to cover both sides of your hand and rub until they are dry. Hold the patient line in one hand and remove the pull ring with your other hand. Drop the ring onto your lap. Keeping hold of the patient line, with your other hand, pick up the transfer set and remove the mini cap. Drop the mini cap on your lap and connect the two at once. Wipe away any excess iodine with gauze. Avoid touching the patient line and the transfer set to prevent infection. Open the transfer set twist clamp. Press Go. The cycler will begin draining. Have a good sleep. In the morning, the cycler will say end of therapy. This means the last exchange is done and you may record the data from the night's cycling. Get your activity log ready to record the numbers. Press the down arrow one time for each of the numbers. Press once for eye drain. Next is total UF, average dwell time. Record the data in your activity log. Press Go. The cycler will say close all clamps. Close your transfer set twist clamp and ensure that it clicks in place. Close all the clamps on the cycler. Press Go. The machine will say disconnect yourself. Open the mini cap package by placing it foil side down on your supply surface. Peel back the packaging and expose the mini cap. Wear a mask if you are coughing or sneezing. Clean your hands using the hand gel. Place the fingers of one hand on the light blue area of the transfer set. With your other hand, undo the patient line connection. Keep the transfer set in your hand, letting the patient line drop to your lap. Retrieve the mini cap from the packaging and place it on the transfer set immediately. Wipe away any excess iodine from the transfer set and secure it away. Properly securing your catheter to your abdomen using tape or a PD belt like the one shown here will help prevent accidental pulling of the catheter, which can cause infection. Take your sitting blood pressure and record the results. Take your standing blood pressure and record the results. Weigh yourself and record it in your therapy log. Open the cassette door, remove the cassette, lines, and bags, and then close the door. Discard the cassette and bags in your household garbage. Press go. The cycler will say, "Turn me off." Turn off the machine and enjoy your day. How to use Opti-caps. During the night while you are on your cycler, you may need to leave your cycler to go to the washroom or get up and move around. You can safely disconnect from your cycler and reconnect using the Opti-caps. It is best to disconnect from the cycler during a dwell phase, but it can be done at any time. First, press stop on your machine. Clean your hands using the hand gel. Then close your transfer set twist clamp and clamp the patient line. Open the Opti-cap package with the foil face down on your work area. Disconnect the transfer set from the patient line. Keeping hold of the transfer set in one hand, place the patient line into the cycler organizer. Take the Opti-cap and place the mini cap on your transfer set. Remove the blue ring and place the large cap on the end of the patient line. When you are ready to resume your cycler therapy, clean your hands using the hand gel. Holding the cycler tubing in one hand, remove the large cap on the end of the cycler patient line. While holding the patient line, pick up the transfer set with your other hand and remove the mini cap on the transfer set. Connect. Open the transfer set twist clamp and open the clamp on the patient line. Press go. Fluid balance and dialysis solutions. With peritoneal dialysis, it is important to achieve the right balance of water in your body. Fluid balance is determined in 3 ways: weight, blood pressure, and swelling. Weight. The amount you weigh when you have the right amount of fluid in your body is your goal weight. Your goal weight is determined by your dialysis team. Weighing yourself every day will help to ensure that you stay at your goal weight. You can help maintain your goal weight by watching how much you drink, how much salt you use, and by the amount of fluid that is removed with dialysis. Blood pressure. Your blood pressure measures how hard your heart is working and how well it is resting. Both high blood pressure and low blood pressure can be a concern. High blood pressure. Blood pressure can increase if there is too much fluid in your body. This can cause your heart to work harder than it needs to. Removing excess fluid with dialysis may help to reduce your blood pressure. Your dialysis team will help you determine what is a good blood pressure for you. Low blood pressure. If you do not drink enough water and the dialysis removes too much fluid, your blood pressure can become too low. You will feel tired, weak, nauseated, and may even faint. If this occurs, you need to drink more water and make changes to your dialysis to remove less fluid from your body. If your blood pressure is very low, you should contact your dialysis team. Swelling. Swelling may occur if there is too much fluid in your body. The most common places to swell are the ankles, calves, hands, eyes, and abdomen. It is important to weigh yourself, take your blood pressure, and check for swelling on a daily basis. This will determine if you have too much or too little fluid in your body. Checking your weight and blood pressure and looking for any swelling every day will help you and your dialysis team determine the right dialysis for you. Dialysis solutions. There are different types of dialysis solutions. Different combinations of solutions are used to help you stay at your goal weight, manage your blood pressure, prevent swelling, and ensure your best possible health. One type of solution is called Dianyl. It contains dextrose, or sugar. More sugar, meaning a higher percentage, will remove more fluid from your body, which helps to lower your blood pressure and weight. 1.5% Dianyl is a weaker strength solution. 2.5% Dianyl is a medium strength solution. 4.25% Dianyl is the strongest solution. Two other types of peritoneal dialysis solution are Neutranil and Extranil. 1.1% Neutranil contains amino acids or protein and helps to provide nutrition. 7.5% Extranil contains isodextrin. It can dwell in your peritoneal cavity for a long period of time. Neutranil can be used once or twice daily as prescribed by your dialysis team. Extranil can only be used once per day. Your dialysis team will help you determine which combination of dialysis solutions is best for you. Taking care of your exit site. It is important to take care of your catheter where it exits your abdomen. Keeping it clean and dry helps to prevent infections or other problems. When showering, you will need supplies nearby to change your dressing. They are gauze, antibacterial pump soap, a clean dressing, and some tape. Before getting in the shower, remove the old dressing and tape your transfer set to your abdomen to prevent it from pulling. Shower and shampoo as usual and gently wash the exit site with soap. Rinse off the soap and pat your exit site dry with gauze. Your dialysis team may prescribe antibiotic ointment for you to use before you apply a new dressing. Ensure that the dressing remains dry throughout the day. Showering is the preferred method of bathing. Never sit with the catheter exit site underwater. Saunas, hot tubs, and baths are not recommended because they may raise your blood pressure and increase your risk of infection. If you fill the bathtub with only a small amount of water and you are careful not to wet the dressing, you are permitted to bath. Your dressing should be changed following a bath. Clean the exit site as usual at the sink with antibacterial soap and gauze. Prevention of infection. Peritonitis is an infection caused by bacteria entering into the peritoneal cavity and is the most common complication of peritoneal dialysis. Peritonitis can occur if there is an infection close to the catheter site or if there is a contamination during the exchange process. There are 4 main things you can do to help avoid an unwanted infection. Washing your hands. It is easy to take hand washing for granted, but it is important to do it properly to prevent infection. Turn on the tap and keep the water running until you are finished. Wet your hands. Pump soap from a container into one hand. Spread the soap over your entire hands and wrists. Add water and create a good lather. Use a lot of friction by rubbing your hands together vigorously. Use a nail brush to clean fingernails properly. Wash for 30 seconds. Rinse your hands under running water and dry them well with a paper towel. Use the paper towel to turn off the taps. Keep your dialysis work area clean. Your dialysis area must be cleaned daily with soap and water or disinfectant. It should be a dry, well-lit, uncluttered area that is also free from drafts. Keep pets or any unnecessary people away from this area and avoid any distractions. Keep your IV pole and cycler clean as taught by your dialysis team. Dispose of used bags and tubes daily. Keep your clothes and bed sheets clean. Establish a daily routine. Although you may feel overwhelmed at first, soon dialysis will become part of your regular schedule. Doing the procedure the same way each time will reduce the chances of infection. Avoid contamination of your catheter. Contamination may occur if 1. You touch the unprotected end of the transfer set with your hands or anything else. 2. You drop your unprotected transfer set in your lap. 3. You find a leaky transfer set. If you even suspect that one of these things has happened, contact the dialysis clinic or hospital as you were taught. Look out for signs of infection. If there are signs of infection, you must report to the dialysis clinic in your area right away. If it is after hours, you must contact the nephrologist on call or go to the emergency department in your area immediately. Signs of a possible infection include a cloudy bag, abdominal pain with tenderness, fever, redness surrounding your exit site, nausea and vomiting, or an increase in fibrin formation. You may need antibiotics, so do not delay seeking help. Adding medications. You may have to add medication to your dialysis bags if you have an infection or if you see fibrin in your drained dialysis bag. You will need the following equipment in addition to your usual exchange supplies: medication, alcohol wipes, syringe, and a needle. Wash your hands and warm the twin bag in the usual manner. Attach your transfer set to the twin bag and begin to drain as usual, but do not yet hang your bag up on the IV pole. Clean the rubber port of your medication vial with an alcohol wipe and allow it to dry. Preparing the syringe. Open a syringe from its package and lay it on a working surface. If your supplies have syringes and needles that are not connected, you will need to do the following. Open a needle from its package and keep it in hand. Be careful not to touch the exposed end. Remove the protective cap from the syringe. Twist the needle and syringe together and ensure they are tight. Complete the drain and flush your fill line before adding the medication. Using an alcohol swab, wipe the medication port of the dialysis bag and the top of the medication vial. Pull the cap off the needle. Keep the vial on the working surface area. Pull back the plunger of the syringe and inject the desired amount of air into the vial equal to the amount of solution you wish to withdraw from the vial. For example, 1 milliliter of air for 1 milliliter of medication. Pick up the vial and tip it upside down and withdraw the desired amount of medication. Then remove the needle from the vial. Grasp the rubber medication port of the twin bag with your thumb and fingers and inject all of the medication into the bag. Ensure that you aim straight into the medication port and do not poke through the medication port. Invert the bag and squeeze it to mix the medication with the fluid in the bag. Hang the bag on your IV pole and finish your exchange as usual. Immediately after the exchange, dispose of the needle in the container you use for needles, which can be either a sharps container or a plastic bottle with a narrow opening, such as a bleach container. Ask your dialysis team how to properly dispose of your sharps container. Ordering supplies. You, as a peritoneal dialysis patient, will be in charge of ordering your own supplies. As part of your training, the PD nurse will go over how to do this. It is important to order only what is needed, and the simplest way to do this is by counting the inventory or supplies that you have on hand and providing this number to another member of your team, a home patient representative, or HPR. Your HPR works for the company that coordinates having the supplies delivered to your home and will work with you to make sure the whole process is as trouble-free as possible and that your order is as accurate as possible. You will be able to order the supplies by telephone, by fax, or by using email, whichever is the easiest for you. Dialysis solutions and other supplies are usually delivered every 4 weeks. When your supplies arrive, the driver will unload and move the supplies to where you store them. Be sure to keep using your remaining supply before opening the new shipment. You will also need to make certain that there is appropriate storage space where the solution will not freeze or overheat. If you use Neutronil, remember that it should not be exposed to light.